I want to welcome the Derry family to LMI. They're visiting us from Iowa. This is our patient, Gina Derry, and she's here with her husband, Jason, and their kids, MacKenzie and Maxwell. An amazing family. They've all come to continue to support Gina in her battle against ALS. ALS, for those of you who don't know, it stands for Amyotrophic Lateral Sclerosis. And it's a progressive neurodegenerative disease, and it impacts the motor neurons that are responsible for voluntary muscle movements that happen within your body. And over time, as the condition progresses, it paralyzes the neurons associated with things like walking, talking, eating, and breathing. Gina's at a stage, and we'll let her talk about her journey here in a minute. But the reason we wanted to do this is there's over 300,000 people in the world that are suffering from this condition. It is a life-altering diagnosis. The average lifespan of somebody once diagnosed is 3 years. So in this situation, unfortunately, there's just not a lot of options in the US. There are certain FDA-approved medications, but they are very short-term in benefits and very long on some tough side effects. So options are limited. There are clinical trials going on in the US now with stem cells. They're early trials. Those are often long waits, difficult to get into, and with a rapidly progressive disease like ALS, time is of the essence. And the Derry family took charge knowing this and investigated, among other therapies, stem cells. So before we go into maybe that journey, Jason, maybe you want to tell us a little bit about Gina, her symptoms when it first started, and how and when she was diagnosed.
Yes, I didn't really know she was experiencing symptoms at first. About February of 2024, she was having trouble swallowing, coffee and stuff like that, and wasn't really noticeable to the rest of the family. But as April came around, she started having slurred speech, and then in May, it got really, really bad. We're like, man, what's wrong? Are you drunk, or what's going on? Because her speech is really slurred, and she's starting to swallow a little bit harder. So we went to her regular doctor, and they didn't know. They said, well, we can send you to an ENT, we can send you to a neurologist, but let's just start with a MRI. So she started with an MRI. That was all clear, and that was in August of 2024. So everything was good on the MRI. We're like, hey, great, everything tested out. And the nurse practitioner did blood work first, and all that worked out too. Everything came back normal. Everything turned out great. She's always healthy. And then they sent her to an ENT, and they did a throat consult, and they said, well, everything looks good there too. And since she was still having trouble swallowing and speaking, they sent her to do a swallow test and a speech therapist. And the speech therapist was, I think she noticed something wrong pretty quick, and that was like in November, end of September, November time.
And this was in 2024?
Yeah.
Okay.
She started noticing symptoms in February 2024,
right.
And we progressed through MRI, ENT, speech therapy, through that.
Okay, through that time period.
Okay. So as she went through it, everything checked out good.
Yeah, it's a tough condition to just use some of the traditional testing measurements, like an MRI, right? It makes sense to do that because you first think about maybe there's more obvious conditions in a lab, and in those things, and even when we did our lab, and as you know, we did our complete diagnostic panel just to look at things, and you're a healthy individual when you look at a lab. It's not until you do some further investigation that you can kind of drill down and see that the progression. That was one of the first steps we did when Gina came here, was to do our own analysis, neurological tests, labs, and things of that nature, and then design a protocol.
Yeah, we were really cool too. She got Invisalign at the same time in February.
Yeah.
Like, are these things messing with you? They pull your teeth around, and
Yeah.
And we we also went to dentist, orthodontist, and everyone else, and they're like, nope, never heard of it.
Yeah. Yeah.
And so we finally got to a neurologist appointment. Yes, that's another thing. She lost lots of weight. She's about 113 pounds. Well, she's 128 pounds probably at the beginning of 2024. About 113 pounds in June of 2024. And in December, January, she's like 105, 106 pounds.
And that's related to the challenges of eating. Yeah.
Yes. Yep.
Yeah.
And then her last neurological, I think she's around 97 pounds. Going back, when we went to the neurologist, the one knew pretty well that you probably have ALS because they look at your tongue. You can see the fasciculations on the tongue. In your arm, she's had the fasciculations on her arms.
Yeah.
And the neurologist, without even an EMG, was like, I think you have ALS. And we're like, shocked.
Yeah.
Like, holy cow.
Well,
how can you make that determination already? So we're going to another neurologist. That was too quick.
Yeah, as you should. You want a second opinion because it is a life altering, not only for you as a person experiencing it, but for the family that's along with you during that process. So you found out about stem cells. You looked into stem cells and you looked at different options in stem cells, and ultimately you decided to choose us over some of the others. Was there, maybe you can share a little bit of what that process was and maybe what...
I just started looking online, and of course you have every family member telling you you need to do this or that, or what to do. So I started looking at a few just online. I interviewed a few of them, and they're like, come down here, we'll fly you to San Diego, you'll stay in San Diego, they'll take you over to Tijuana, and they'll give you 400 million stem cells in 3 days. And there was no other protocols. And I talked to their doctors and very knowledgeable, but there wasn't a set schedule. Like when I asked questions, it was mostly all about, I'll give you stem cells and then we'll send you home in 3 days.
Yeah.
So when I got a friend actually referred longevity to me, and so that's when I contacted you guys through a friend of mine, and then he had a business partner that was referred you guys to, so that helped. But what ultimately set you guys apart from everybody else is your doctors. When I talked to your doctors, and then Ivana setting things up helped a ton too. So it was really, I call it like a white glove. It was like you had a full team helping out, but your doctors, the knowledge they had and the explanation of what they wanted to do and how things interacted made the decision that much easier for me as I talked to them. I asked questions just because I didn't know. All of a sudden I seen the protocol, I'm like, well, what's exosomes? What's this? Why do this? And they had good answers for it. And then I asked the other stem cell carriers, what do you guys do? And it was all based on stem cells, not the whole protocol and the therapy. And it was a commitment, we're like in 2 weeks, 2 weeks down in Cabo. Sounds like fun, but so it was a commitment for us.
Yeah, I mean, the easy path is say I can go for 3 days, but I think when we explain to you why, and we get to spend the time with you, and we can watch the protocols evolve because they get set, and we set forth those protocols in multiple sessions over different days, and we have reasons for that and the way that your body handles them. So we just done stem cells, right? Exosomes, peptides, and nutraceuticals by IV administration. And those are fantastic systemically. But with this type of disease, you needed to get to the spinal cord and you needed to get to the brain for that neuroregeneration capabilities and the anti-inflammatory. And so today we're going to go through a procedure that's called an intrathecal injection of stem cells in exosomes. So that'll allow it to get into the spinal fluid, to the spinal cord, and into the brain, where the stem cells will do their work and what they're meant to do. So it's an important part of what you're already doing. So we'll be doing that shortly. Are you ready to do this?
Yeah.
Okay. And the family, they brought their kids. I'm not sure where the kids are, but they've been but they've been here. They're an amazing, absolutely amazing family. So if there's not any questions, I think they'll finish off with what you have here today. You'll have So we'll do another IV administration of the stem cells, exosomes, some peptides, not nutraceuticals today because we did that. And then we'll do the procedure in the other room. That'll be with Dr. Paras and Dr. Fergie, you both know. Dr. Ramos will be here, and he'll be overseeing with the ultrasound, and then our anesthesiologist as well. So you're in very good hands. So just continue with, you came in with, you have such great optimism, and you're just, despite how challenging this is, just keep that positive outlook. Just continue to fight, and we'll let these therapies, let them do what they need to do.
Thank you.
Okay, thank you again. So talk a little bit about the therapies and that experience that you went through from the time that you showed up to where you are now. You're 1 week, basically 1 week into your therapies. We did a major one the other day, which was the intrathecal, which we had to do to get to the spinal cord and into the brain, but you've done a series of the IV infusions of stem cells and exosomes and peptides, and then you've used the recharge station and a number of other things that we have here. How have you felt after doing them, and how do you feel like today from when you first started?
Energized, alive, vibrant, hopeful, happy. The beauty is amazing.
The sun helps. The sun, the views, the atmosphere down here. I noticed she feels more fuller.
Okay.
Her body, like I grabbed her hand, she feels stronger.
You feel stronger?
She feels stronger. Her voice is better.
Yeah, no, the speech in itself, because I know that was a big thing when you came here. We can get the speech back so she can communicate. She wants to be able to communicate.
Yeah.
It's in her mind, because with this disease, as you know, your mind's, everything's intact, and what you want to is here, and what you want to communicate it can be frustrating. And so, and I can tell you, everybody here, you've noticed like the speech improvement in over this last week.
Yeah.
And my sister-in-law noticed right away her skin, with the different peptides she's getting. It feels like her skin is, again, has more elasticity to it.
Yeah,
and
you
stuff.
you look healthy, you look good. Your eyes look good. Your eyes are very clear, and your body looks stronger.
Yeah.
And it's great. That's where we want to be at this stage. It takes time for the cells. They're going to do their job. You still have a few more sessions before you leave, but they're going to work their course over the next 1, 2, 3, and so on. And it's going to be great. We want to remeasure that and get all the updates of how are things progressing, what's improving, and how you continue to feel.
Right.
So, thank you again.
Thank you. Yep.
Thank you again.
Appreciate it. Appreciate it.
Thank you.